Theraflu Nighttime Powerpod is a combination medication used to temporarily treat symptoms caused by the common cold, flu, allergies, or other breathing illnesses, such as sinusitis and bronchitis. Decongestants help relieve stuffy nose, sinus, and ear congestion symptoms. Acetaminophen, APAP, is a non-aspirin pain reliever and fever reducer, while antihistamines help relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It is important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years. Some products may not be recommended for use in children younger than 12 years. It is important to ask your doctor or pharmacist for more details about using this product safely. Theraflu Nighttime Powerpod does not cure or shorten the length of the common cold, and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy, and do not give other cough and cold medication that might contain the same or similar ingredients. It is best to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drop/spray. If you are taking the over-the-counter product, make sure to carefully read and follow all the directions on the package label. If your doctor has prescribed this medication for you, be sure to take it exactly as directed. If you have any questions, it's important to consult your doctor or pharmacist for clarification. You can take this medication by mouth with or without food, as directed by your doctor. If you experience any stomach upset, taking this medication with food or milk may help. It's also recommended to drink plenty of fluids while using this medication, unless otherwise directed by your doctor, as the fluids will help loosen the mucus in your lungs. If you are using the liquid form of this medication, it's important to carefully measure the dose using a special measuring device or spoon. It's crucial not to use a household spoon, as you may not get the correct dose. If the liquid form is a suspension, be sure to shake the bottle well before each dose. For those taking the extended release capsules, it's important to swallow them whole and not to crush or chew them. Doing so can release all of the drug at once, which can increase the risk of side effects. It's also important not to split extended-release tablets unless they have a score line and your doctor or pharmacist specifically tells you to do so. Swallow the whole or split tablet without crushing or chewing. If you are taking the chewable form of this medication, be sure to chew it thoroughly before swallowing. The dosage of this medication is based on your age, medical condition, and response to treatment. It's crucial not to increase your dose, take it more often, or use it for a longer time than directed. It's also important not to give children medicines labeled only for adults. If your condition lasts for more than 1 week, gets worse, or occurs with a headache that doesn't go away, a rash, or a fever lasting more than 3 days, it's important to inform your doctor. These symptoms may indicate a serious medical problem and should be checked by a doctor. Depending on the symptoms being treated, you may need to contact your doctor earlier than 1 week, if they last or get worse. Be sure to check your specific package label for when to contact your doctor. It's important to note that Theraflu Nighttime Powerpod 25 mg, 10 mg, 650 mg oral powder in pod decongestants may cause drowsiness, dizziness, and upset stomach. However, many people using this medication do not experience serious side effects. It's important to tell your doctor if you experience any mental/mood changes, trouble urinating, or a fast/slow/irregular heartbeat. A serious allergic reaction to this drug is rare, but seek medical help if you notice symptoms such as severe dizziness or trouble breathing. If you experience any other effects not listed, contact your doctor. As always, talk to your doctor about any concerns or questions you may have about this medication. Acetaminophen is one of the ingredients in Theraflu Nighttime Powerpod 25 mg, 10 mg, 650 mg oral powder in pod decongestants. It's important to be cautious with acetaminophen, as taking too much can cause serious liver disease. Adults should not take more than 4,000 mg, 4 grams, of acetaminophen a day. If you have liver problems or are giving this medication to children, you should take less acetaminophen. It's best to consult with your doctor or pharmacist to determine a safe dosage. It's crucial not to use any other medication containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen is found in many over-the-counter and prescription medications, like pain/fever drugs or cough and cold products. Be sure to check the labels on all your medicines to see if they contain acetaminophen, and ask your pharmacist if you're unsure. If you accidentally take too much acetaminophen, overdose, seek medical help immediately, even if you feel fine. Overdose symptoms may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing of the eyes/skin, and dark urine. It's also important to note that daily alcohol use, especially when combined with acetaminophen, may harm your liver, so it's best to avoid alcohol while taking this medication. Before taking this product, it's important to talk to your doctor or pharmacist if you have any allergies or health problems such as breathing issues, diabetes, glaucoma, heart problems, high blood pressure, kidney or liver disease, seizures, stomach/intestinal problems, an overactive thyroid, or urination problems. This medication may cause dizziness, drowsiness, or blurred vision, and using alcohol or marijuana can increase these effects. It's important to avoid driving or using machinery until you know how this medication affects you. Some brands of this product may contain sugar, alcohol, or aspartame, so be cautious if you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit these substances in your diet. Before having surgery, make sure to inform your doctor or dentist about all the products you are using. Children and older adults may be more sensitive to the side effects of this medication, so it's important to be cautious. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using this medication with your doctor. It's important to be aware of potential drug interactions when taking Theraflu Nighttime Powerpod 25 mg, 10 mg, 650 mg oral powder in pod decongestants. Always keep a list of all the products you use and share it with your doctor and pharmacist. Certain products such as ketoconazole and levoketoconazole may interact with this medication. Avoid taking MAO inhibitors during treatment with this medication, and be sure to inform your doctor if you are taking other products that cause drowsiness. Additionally, be cautious of using other antihistamines or medication with similar ingredients, as it could increase side effects. It's also important to note that this medication may interfere with certain lab tests, so make sure to inform lab personnel and your doctors that you are using this drug. If someone has taken too much Theraflu Nighttime Powerpod and is experiencing serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical help. In the US, you can call the local Poison Control Center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Overdose symptoms may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing of the eyes or skin, dark urine, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Make sure to keep all of your medical and laboratory appointments. It's important to stay on top of your health and make sure you're getting the care you need. This includes scheduling regular checkups and any necessary tests or screenings. By keeping up with your appointments, you can stay informed about your health and make sure you're taking the right steps to stay healthy. If you are taking Theraflu Nighttime Powerpod on a regular schedule and happen to miss a dose, take it as soon as you remember. However, if it is close to the time of your next dose, it's best to skip the missed dose and wait for your next scheduled dose. It is important not to double the dose to make up for the missed one. Stick to your regular dosage schedule for best results. It's important to store Theraflu Nighttime Powerpod at room temperature, away from light and moisture. Make sure not to store it in the bathroom, and don't freeze the liquid form. Keep all medications out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. Remember, always follow the recommended guidelines for medication disposal to keep your family and environment safe. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.